Morning fellas, or afternoon as the case may be, and thanks for watching. This is day 8 since the surgery, and I feel great, feel fine. I've been back at work a day, and and to all intents and purposes I'm firing on all cylinders. I had the cystogram and the catheter out yesterday, and that was a very simple procedure. This was prior to seeing the surgeon, and the cystogram sounds worse than it really is. All I did was go into an X-ray room, lie on the table. They plugged a bag into my catheter. The bag had about half a litre of saline and a radio opaque dye in it, which can be picked up on the X-ray. So he let about 150 mils of that run into the bladder, which I didn't even know was happening, and then they took quite a number of X-rays with me lying on my back, lying on one side, lying on the other side, just to check that there were no leaks from the join in the urethra. There weren't, fortunately. So the dye was emptied. And then the nurse came in and she said, right, we'll take the catheter out, take a deep breath, and before I had a chance to take a breath, woof, the catheter was gone. That was just about half a second of mild discomfort, but you've no idea how nice it is to get rid of the catheter after a week or so. As I've said before, the catheter is not painful, it's just a nuisance. You just get sick of having a bag on the leg and a bag on the floor when you're trying to sleep at night, and trying to roll over at night with a tube connected, etc. So just a nuisance, but certainly nothing to be afraid of. And I'll reiterate here, and I've said this before, for 40 odd years the thought of having a catheter worried me. I've now had a catheter twice for a week at a time on each occasion, and no big deal. Having the catheter inserted was mildly uncomfortable, more strange than uncomfortable, because you haven't felt this happen before. It certainly wasn't painful, and the relief to have the bladder emptied after you've been waiting for several hours was nice. Wearing it, as I say, is just a nuisance. Having it out is not at all painful, and you're just glad to see it gone. So yesterday the catheter came out. As my surgeon said to me, most people after prostate surgery, when the catheter comes out, they pee on the floor, and they need to wear a pad for a week or a month or 6 months. In my case, I had to wear a pad for about half a day, and that was not because I was urinating in my underwear. It was simply when I was walking somewhere and I changed direction in a hurry, or went to pick something up, or made a rapid movement without thinking about it, then I had a slight bit of leakage, a teaspoon or so, or less, into my underwear. That disappeared overnight basically, and so that's not a concern. I said to the surgeon, when I saw him after the catheter was removed, and he said, are you continent? And I said yes. And I said, is that because I did a lot of exercises before the surgery? Is it because of good luck, or is it your skill? And he said, well, he said, I would have to say my skill, but he said the robotic surgery means that we can see a lot better. And he said, during open surgery it's difficult to actually see the sphincter at the bottom of the bladder. He said you've got your head down on the patient's chest and you're trying to look at underneath the pubic bone to see what you're doing. He said with the robotic surgery it's right there in front of you on the screen, and he said we can take a lot more care, and he said I didn't damage the sphincter, and so he said you are not going to have continence issues, and he was right. So where to from now? So I'm back at work. I've been back at work yesterday afternoon and today. I'm walking and doing everything almost as though I haven't had any surgery. I certainly don't have any discomfort, other than a little bit of bladder tenderness when the bladder is full, and it's still a little bit tender to urinate, but that will disappear. So where to from here? The surgeon wants me to have a PSA test in 6 weeks, and if all has gone well, which he is totally confident of, then my PSA levels will drop to close to 0 or below 0.2, and if that is the case, then I'm home free for 10 years or more anyway, and I'm 71 now, so the next 10 years is a bonus, all of them. As I say, urination is not a problem. Sexual function, he's given me a prescription for some Viagra, and he wants me to take about a quarter or a third of a tablet per day, starting in about a month's time, and hopefully things will go well there. I mean, if they don't, one has to be philosophical, but he carried out nerve sparing surgery, and he said there was no damage to the nerves, and he's fairly confident everything is for me apart from my age. I can't do any heavy lifting in the next month or so, but that's simply because I have the central scar on the belly is about that wide, and that was where they put the camera, I believe. And if you start doing heavy lifting early on, there's a possibility that you might have a hernia there. So that's not a ball breaker. So yeah, all in all, I'm pleased that I had the surgery. The recovery was much better than I thought it was, much better than I was afraid it might be. So if you look at the video that I did 6 hours after the surgery, it looks as though I'm knocking on death's door. I wasn't, and I felt a lot better than perhaps the video conveys. I wasn't in pain. I was in a little bit of discomfort. I was pleased that it was over, and I was hungry and very tired. So don't let that put you off. Each day from then on, the improvement from day to day was quite rapid. My memory of the whole experience, and I'm doing this video after 1 week so I don't forget, my memory of the whole episode, probably the worst part was staying in a motel away from home, putting up with my wife's driving, lugging a catheter around, and a bloated feeling. My stomach was bloated, and I couldn't eat anything like a normal sized meal, and after I did eat, I had what felt like indigestion pains, and also pain in the shoulders, which I understand is irritation of the peritoneum, and quite normal, and that was a little bit painful, but lying down made it go away. Painkillers, I took 2 paracetamols a day in fact I took 3 a day for the first 2 or 3 days, and then 2 per day for a couple of days, and then nothing from then on. So as I say, that was probably the worst part of the whole procedure, the bloated feeling, and having to manage your bowel, because that wasn't working too well for a short while. But all in all, the procedure was much less, I think I've said this before, much less than what I was afraid it might be. So if you're facing prostate surgery, guys, I can only recommend the robotic, and get it done, because it's nowhere near as bad as you think it might be.